Michael, you're an independent TD from Clare. We've had people from Clare sitting here this morning that are like, it takes me 2 hours to get into UHL in order to get treatment. No one wants to go there. We're afraid of going there. What is what's happening? Obviously, what's happening in UHL is a disaster. Do you agree?
No, it is. I mean, the health service across the country is under pressure, but it's under particular pressure in UHL. I mean, it is by far the worst hospital consistently. It is something that needs to be remedied.
What is that remedy? Because we're talking about this in government and nothing's ever happened.
Consistent governments going right back to the 1980s have underfunded the Midwest as regards healthcare provision. That can't be sorted out overnight, but it can be sorted out. But that underfunding continues right up to the most recent spending review in 2022 that was published about a month ago by government. So, I mean, there is a historical underfunding. It needs to be addressed, but it is unfortunately taking time. Unfortunately, I also think there's a problem with management of existing resources. I mean, I accept that we're asking management to do a loaves and fishes job, and that's impossible. I mean, they can't work a miracle. But on the other hand, there was a lot of criticism of management in the HICWA report of June 2022 into the unannounced visit, which found that the level of overcrowding posed a risk to patient safety. Now, when that risk to patient safety results in a young girl dying without adequate treatment, that is a national disgrace.
Yes.
When we find out that a man from the same town died 3 years previously and rigor mortis had set in before he was seen, that is a disgrace. And that is the only, I mean, I accept that health is a problem across the state and every TD from every part of the country is talking about health. But there's a particular problem here and it needs to be taken in. The Taoiseach has a very limited amount of time available to him. There's a very limited number of problems that he could actually sort out. I wrote to him, I asked him to take reform of the HSE into the Taoiseach's department to sort it out quickly, to do what needs to be done,
but listen,
make it
we
the best
know
hospital
that Simon Harris
same as every
has promised before, when we talk about scoliosis and not having to wait over 12 months for treatment. He has been the Minister for Health. He has seen this. But we had Marie McMahon. You just mentioned the young girl who passed away. We had Marie McMahon.
Lisa Johnson and also Martin Abbott, both from Shannon.
Her husband died on a trolley at 11 o'clock at night. He wasn't found until 4 o'clock in the morning. She received a phone call.
He was alone.
He died on his own. He died alone on a trolley, backed up, head to toe. That's not the level of healthcare we want to provide, your government want to provide, is it?
That's unacceptable. And, once again, it's his anniversary, he's passing. So there is no excuse. I think the immediate issue here is we must bring down the numbers of people on trolleys. And this is a very important point for me, and this has dominated my political life here. And I have fought and campaigned with others to get extra resources into the hospital, got the 16 modular block built with the 96. The resources, there's 20 million being given to UHL now on top. That the medical
45% budget.
More immediate measures.
Massive.
More immediate measures.
But where's it going?
The medical assessment units will now be open till 12 o'clock. We've spoken about the 86 beds. We need to see the improvements. There's a director now being put in terms of patient flow. We need to see the decision makers on the ground, the senior consultants, so that decisions can be made and discharges can be made in time.
You're talking about beds. Beds all need to be staffed.
Yes.
And they need to be staffed by quite a number of people. We don't have safe staffing levels in countries around the hospital. There is a private hospital opening in Limerick. The Bonds is opening on the Ballysimon Road. When that comes, people think there's going to be an exodus from University Hospital Limerick because staff do not want to work out there, and why wouldn't they work in a lovely private hospital? How are you going to staff those beds when the private hospital opens?
I heard Professor Watt on earlier, and there's been a relatively low take-up on the new public contracts for consultants.
Yes, very low.
But he did say that 40% of the consultants in DD taken up the public contract.
But you can't. But also, we can't get nurses. We can't keep nurses in Limerick.
But it is fair to say that if you look at, we'll say, in the last number of years, well over 700 of medics between nurses and consultants have been taken on board in UHL. We continue to recruit, and in terms of resources...
We've got a private hospital, two possible private hospitals coming on board in this area. Why would they stay in the public system?
No, the more immediate thing here is, over the next number of months, the 105 people on trolleys yesterday in UHL. That's unacceptable. The resources have been put in. We expect to see, on behalf of the people of Limerick and the region that we represent, that those trolley numbers will start to...
Carl, you're on the Oireachtas Health Committee. I'm flabbergasted to think that the management site for UHL isn't even on site. The computer, there's no integrated computer system within the HSE as well. It is archaic. If you want to go from one hospital to another, you have to carry.
Does more about your car. Your NCT tells more about your car than your health. There's no mobile record that follows.
You're a politician, you're the one who's involved in it.
Just a few things to come in on there. First of all, we've an incredible university out the road. Went there myself. I was in college with your weatherman Derek, but there's incredible nursing graduates coming through there every year, and it's devastating to see that photo during
half
COVID.
Half of them are leaving to go to Australia and Dubai.
Finish my point. That photo during COVID of 60 or 70 doctors, nurses weren't on the beach in Melbourne. I've spoken with Stephen Donnelly in the Nursing United. We need to bring in a criteria where perhaps in their final year of training there's a bursary for those who will remain here. I think it has to be more carrot than stick, but we have to turn that back. If you're graduating from medicine or nursing, you have to give service here. It makes no sense.
You think it should be obligatory, compulsory to have to give?
It makes no sense to have
how many years do you think they should have to give?
I think there should be 3 or 4 years.
Compulsory.
And every person who goes through the Irish college system, education is funded by the taxpayer. We should have some bursary. Now, we need to deal with accommodation for nurses as well, because it is nigh impossible for them to work, certainly in the city environments. But that needs to be dealt with. There will be a digitalisation of patient records, by the way, because it is absolutely woeful at the moment.
But who was in charge? The whistleblower had to leave because
I think blaming young people because they want to go abroad and work in a properly managed health system is not going to work. Penalising them for going abroad just means they'll stay abroad for a lot longer. I mean, that was something that governments have looked at. So I must say I don't agree with that approach. What we do need to do is to make it a system that they want to work in, because they're not. I mean, there are many reasons to go to Australia around the weather, particularly this spring, but people want to be close to their families, people want to be close to their friends and their networks, and they're going abroad because they don't want to work in a chaotic system where I have been in that A&E as Cathal as everybody has. It's chaotic, and at the end of the day the nurses know that when it goes wrong, and it does go wrong, it inevitably goes wrong very often when it's as overcrowded as it is, they're the ones who are going to carry the can. They're the ones who are going to be blamed in reports and hauled over the coals, and they're the ones who are going to have to face a grieving family and say the system let you down. And it's not. You know, we can continue like this. Simon Harris makes a lot of promises. He makes more promises than any other politician in the history of Ireland. He is a former Minister for Health.
Yeah.
He's a Minister for Health in the lifetime of this government. I would ask him, and I thank you very much for having this programme here this morning, for giving the people of the Midwest an opportunity to just explain that we're not second-class citizens.
Well, they seem
we're not looking for a perfect
health.
We're not looking for a perfect healthcare system.
Angry.
We're just looking for the same level of healthcare as every other part of the country. We talk about Irish independence, the struggle for independence. It was fought on the banks of this river, and we deserve the same level of a hospital. Nothing special, just the same. But he has an opportunity. He does have an opportunity.
I know.
Listen,
Mike,